Hi, my name is Jenny, and these are the responses that I received from conducting my individual assessment interview with Haley DeLuca, the school psychologist at the Kenosha School of Technology Enhanced Curriculum, where we both teach at the West Campus. It is a K-8 public charter of the Kenosha Unified Schools. First question asked Haley what her perspective on psychoeducational assessment was. She gave us some examples of commonly used tools and reminded us that while norm reference comparisons are helpful in determining if a student has an area of concern in relation to their same age peers, they aren't enough to make eligibility decisions alone. In the state of Wisconsin, two criteria are required. One, the student must show insufficient progress on two intensive research-based interventions in a reasonable amount of time, and they must evidence inadequate classroom achievement. And to measure the inadequate classroom achievement, Haley uses the Woodcock-Johnson, like we are learning how to proctor in our class. There is a debate currently in the state of Wisconsin about the evidence to show insufficient progress in interventions because the wording of quote unquote reasonable amount of time is very subjective and might vary from district to district, resulting in students who are eligible possibly not receiving services. So it'll be interesting to watch where that debate ends up. How effective is RTI implemented at KTEC? I appreciated our principal's honesty and candor in sharing with us that after filling out the recent school-wide implementation review, KTEC falls within the initial implementation phase. I believe this is our third year of implementing RTI. And so things we're doing well at is having a set criteria for determining which students move to tiers 2 and 3. We're regularly giving the Ames Web as our CBM probes every Friday, and we use that data to guide our selected intensive intervention groups. Ways that KTEC can improve would be on using the data we're collecting to actually drive our core instruction rather than just interventions, and ultimately to develop culturally responsive practices. There is a disconnect between data from progress monitoring and core small group instruction in that classroom teachers who are giving select and intense interventions do not have access to the Ames Web Probe information that's being collected. The instructional coaches, which are the ones teaching the tier 3 reading intense interventions on leveled literacy, they have access to the Ames Web probes, but the probes are actually being given to all um, intense students, whether math or reading. So we need to close that feedback loop between the math intense um, data that's being collected and the instruction that is driving it. What instruments are used to assess reading skills and progress? Common assessments are mandated at KTEC that we must give common assessments between schools by grade level and by subject area. And then we also implement standards-based grading. The MAP and STAR are proctored 3 times a year. And even though they're widely used as evidence in our TIU course discussion, um, there are individual criticisms of each. So it's important that we use as many data points as we can collect rather than simply looking at 1 or 2 individual points. The specific criteria that KTEC has set for Tier 3 intervention, whether it be math or reading, is that if a student is below basic on STAR and at or below the 40th percentile on their MAP, whether it's in math or reading, then they will be put in an intense math or reading group. However, if a student meets both criteria in both subjects, reading is the priority over math. And the reasoning behind this is our intervention time is 1:30 to 2:15 for 7th grade daily, Monday through Thursday. And level literacy must meet 4 times a week. And so therefore, reading is the priority initially. I do believe that is not a sustainable priority for long-term success for a student because I believe math is just as important as reading. Currently, we do not have a research-based intervention that's being utilized for Tier 3. So Tiers 2 and Tiers 3 look similar. And I can directly speak to this as I give math interventions in my room daily. And so how that looks is students that are in Tiers 2 and Tiers 3 are receiving small group instruction from me on a different skill set based on the needs of the students in those groupings. Our test of visual motor perception used in your school. The occupational therapist does assess if a student needs a service, and the school psychologist uses the Beery VMI. An example the school psychologist gave me of how this test would be used is if a third grader had a difficult time copying or writing from the chalkboard to their notebook. The Beery VMI determines if it is a visual perception issue, motor coordination issue, or a combination of both. Are technology enhanced assessment systems used in your school? As mentioned earlier, MAP and START are proctored 3 times a year, and Ames Web is what we're using for progress monitoring. Instructional coaches use the probe data to ensure that students in a reading intense intervention are evidencing growth. They also collect the probe data for math intense students to hopefully show growth as it connects to our small group instruction. The advantages of using these systems are that students in intense interventions are progress monitored weekly. The data trends are easily accessed and analyzed through reports on Ames Web. The disadvantages are that classroom teachers who are teaching math intense instruction, small group, or core instruction are not given access to Ames Web to be able to analyze that data in reference to their instruction. How effective are curriculum-based measures of assessment used in your school? Our coaches and teachers analyze the MAP, STAR, and PALS data to determine which students need additional supports through select and intensive interventions. Once those students are identified, they are then progress monitored through Ames Web probes that are administered weekly. That data is used to look across classrooms and grade levels to determine where our students are excelling and where they need to make improvements, which should ultimately drive instruction. To what extent are cognitive assessments used in your school? Historically, cognitive assessments were given for probably every SLD evaluation, but we have to remember that since IQ scores are not required for most special education areas, it might not always be appropriate to give a student extra assessments they don't need. So the one area where a cognitive assessment would most always be given is if an intellectual disability is suspected. Haley did mention that sometimes in an ELL case or an OHI eval, it might be used if the team determines that data might be helpful in driving their decision-making process. How are students evaluated in realms where subjective assessment is more common, such as writing and art? The school psychologist does give assessments in writing to determine if it's related to a physical ability, which an occupational therapist could help with, or whether it's writing mechanics or conventions. And if it's the latter two, Ames Web can give us a percentile comparison of where that student is in relation to their peers. K-Tech does implement standards-based grading, including in special areas, to hopefully minimize the subjective part of assessments, although I would argue for any subject, that is always an issue a teacher has to grapple with. The process for identifying students in special education at your school is almost identical to the one that was mentioned on the Parent Center Hub resource that Dr. Wright shared with us. The only change I saw was that we call it a CSI meeting, a collaborative student intervention meeting, is the initial meeting that we set up after a parent has requested a meeting or a staff member at the school feels like it would be helpful. And we have a CSI date that's already preset every month. And so when we have a concern, we just place it on the calendar, and then a team is assembled to figure out how to best meet that child's needs. And typical members at that meeting would be the program support teacher for special education, the parent, and administrator is always present at K-Tech, and I appreciate that about them. The school psychologist, if the concern is behavioral, a social worker or a counselor, preferably both, would attend the meeting. If it's academic, the instructional coach would be there, and a classroom teacher is always representative. Although at the middle school level, we usually designate one classroom teacher to represent for the team, and that representative collects data from the team before they come to that CSI meeting. Haley said the thing that she enjoys most about working as a school psychologist is that she enjoys problem solving and working with lots of different types of people. And I do believe she plays a critical role when she places her piece of the puzzle on the table. But it's a really wonderful response that she shares with us that we all need to remember parents, teachers, administrators, PSTs, and all related service providers hold other pieces of the puzzle. And it is a wonderful privilege to be able to collaborate with so many wonderful voices that are trying to defend and determine what is best for each child.